Passion for institutional history comes naturally for me in my role as university archivist. I'm happy to be participating in the History and Health Racial Equity program and look forward to sharing some of what I have learned about the former Medical College of Virginia, today's VCU Health and Medical Center. I want to look at the institution's historical legacy and talk about 5 themes: anatomy, student culture, urban renewal, segregation, urban renewal, and research. In each of these themes, you will learn, rediscover, or remember what shaped our institution's culture and created a climate for racism. Anatomy has been an integral part of medical education in the United States since its formal inception at the University of Pennsylvania in 1765. The faculty that started what was the medical department of Hampton-Sydney College felt that it was a keystone of the educational program, as you see by the quote on your screen. It dictated everything about the institution in its formative years, including the selection of Richmond for the formation of the medical department. Although this is a rather idyllic and perhaps pastoral image of Richmond at the time of the founding of the school in 1838, Richmond was in fact developing as a manufacturing and industrial town, working its way to being a city. You see the population listed in the top right-hand corner, and you'll notice that almost 1/2 was a people of color. MCV was founded in 1838 as one of the 30 medical schools that emerged in this country in that time frame. The school was the dream of this man, Augustus Warner. It was he and 5 other faculty members that started the school. He saw the opportunities that Richmond offered, primarily that Richmond was a major center for the slave trade, and that its industry would support many individuals, either enslaved, free, people of color, or white, that might be working in the city and not have families to care for them. In this environment, a medical school can benefit. You'll notice the ad on the right-hand side was taken out by the medical faculty in December of 1838, right as the school opened, appealing to the owners of the enslaved and others to bring their patients to the school whenever healthcare was needed. The school started initially in the old Union Hotel building that you see in the upper right-hand corner. Obviously, it was not designed to be a medical school, but within 6 years, they had outgrown that facility and were able to construct a building of their own in Academy Square, where it's located today. I'm sure you all recognize this as the Egyptian building. This building was designed to accommodate anatomical instruction, including areas for dissection by students. That was on the upper floor, that was illuminated by skylights that were in the top of the building. The problem of procuring cadavers for dissection was a tricky one. There was no legal way to procure cadavers for dissection in Virginia at this time in the 19th century, which meant that the professor of anatomy engaged with individuals in the community known as resurrectionists to go and procure bodies for dissection. They were all stolen, often from the paupers' burial ground, but also from the burial ground near the state penitentiary that was in the center of Richmond at the time. The institution had a little bit of a PR crisis in the 1860s. As you see by the quote that I pulled from this particular article, when there was a public debate about creating a separate marine hospital, there were indications that the community felt that individuals that came to MCV and passed away were likely to end up on the dissection table. So although there were defenders that responded and indicated that individuals who passed away at MCV were not used on the dissection table, but were in fact buried, it took the dean of the college taking out an ad in the newspaper to again try to refute this statement and do what he could to repair the damages. Well, although the faculty claimed that the utmost circumspection had been used, this was something that would not go away and continued to fester and hurt the institution throughout the 19th century. In the latter part of the 19th century, an individual by the name of Chris Baker, you may have heard stories of him, and you see him on the left, in the image on the left, was in charge of the anatomy room, and he was the one that most often worked with other individuals in the community to accept bodies that were brought to the school, but he also led his own grave robbing expeditions with students. In 1882, he was caught and prosecuted, as you see by the indictment on the right. The medical faculty was able to speak for him, and he was let go without serving any time. This was a very high-profile case, and it and other factors ultimately led the Virginia General Assembly to pass the Anatomical Act of 1884, which allowed for, as you see, the secondary thought in the title of the act, protection of graves and cemeteries, but primarily they were thinking they were promoting medical science because they were making a way for medical schools to be able to procure cadavers for instruction purposes. The little article on the right came from 1897, and still there was much grief about cadavers for dissection. In this case, it is a pending execution of a criminal, and that body was going to go under law to the medical school. And what is expressed are the sadness of the family about this situation. This whole legacy unfolded for many people for the very first time in 1994, when the university was preparing for the construction of a new medical sciences building, a building we know as the Contos Medical Sciences building today. Human remains were discovered in an old well 25 feet below street level. The well was filled with water, and the archaeologists were given just a brief amount of time to excavate the human remains that were found in the well. These materials were cleaned and subsequently sent to the Smithsonian Institution, where they were to be studied and a report filed with the Department of Historic Resources. Although the find was initially reported in the Richmond Times-Dispatch in May of 1994, nothing ever became of this project once the remains were sent to the Smithsonian. We have to fast forward to 2013, when the university finally began to address this matter and worked with a group to form the Family Representative Council. You see some of the members here standing outside the Egyptian building. And working with this group, there are now some recommendations on how to move forward with the human remains and give them the respect they never got at the time of their passing. The remains were brought back to Richmond after having spent some 26 years at the Smithsonian in November of 2019, with very solemn ceremonies held at the Smithsonian, at the site of the well near the Contos building, and at the Department of Historic Resources. Health Sciences students from VCU participated in all the events. You'll be learning more about this in subsequent programs in this series. Now I'd like to move on and talk a little bit about the concept of segregation. We kind of think of this as something that comes about in the late 19th century and certainly a dominant theme of the 20th century. But even back at the beginning of the school, there were separate facilities, separate areas, and separate prices for maintaining people of different color, as you notice in the advertisement for the infirmary on the right-hand side. There were also differences in what patients were receiving what care. Professor Charles Bell Gibson, who was the son of a very famous father, Dr. William Gibson, who was on the faculty at the University of Pennsylvania, came to Richmond in 1847 to take up duties as the professor. And he took advantage of the many people of color that sought help at MCV to try out his new surgical techniques using anesthesia for the first time. He wrote extensively about his clinical work. It appeared locally in journals such as the Stethoscope, which is Virginia's earliest medical journal. Now, this idea of a medical school in the South, part of education of medical students in the South was this concept that there were actually physiological differences between the races. And this kind of indoctrination went on not only in the South, but in the North as well. There were many Southerners who were on the faculty at the leading medical schools in Philadelphia at the time. Two Virginians who happened to be up in Philadelphia in 1859 when John Brown was hanged by the Commonwealth of Virginia, decided to kind of exercise their Southernness, if you will, and they led a group of Southern medical students to secede from the schools that they were attending in the North and come south for their medical education, with 144 of them stopping in Richmond to continue their medical studies. They were welcomed as conquering heroes by Virginia Governor Henry A. Wise, who was also anxious to have Virginia secede and join the newly forming Confederacy. And you see the chronicle of this movement in the local papers at the time. Now, when the Civil War then followed, obviously MCV was in the midst of what became the Confederate capital. They took a very active role with the Confederate government, primarily with the Confederate Medical Department. All the faculty served in a variety of capacities. The image that you're seeing on the right is a portion of an image from 1865. So it actually shows the position of the Egyptian building and how the community looked at the time. On the left is a document that shows very endorsements as this particular document wound its way through the Confederate bureaucracy as the institution, I believe, was seeking some supplies and using their close proximity and their relationship with the Confederate government to try to procure provisions, which was very difficult during the war. Well, the institution has always been very proud of their role during the Civil War, even though they were on the losing side, and have promoted it throughout the years. There was a large plaque on the exterior of the Egyptian building that has now been removed, acknowledging the role not in the Civil War, but in the war between the states, a Southern euphemism. There was an article that appeared in the alumni magazine that you see in the upper left-hand corner talking about the role of the faculty during the war. And finally, in the midst of the fervor for the Civil War centennial during 1961 and 65, MCV partnered with the Daughters of the Confederacy to create a chapel in West Hospital dedicated to former Confederate President Jefferson Davis. Hunter McGuire, who led that secession, would continue to be a very influential character in medicine, in Southern medicine in particular, and was revered for a good period of time. But he was very much an unreconstructed rebel and very much a racist, as you see by his very infamous publication that appeared first in the Virginia Medical Monthly and subsequently was released as a separate publication. So getting back to our theme of segregation here, in the post-war period, this institution now operated a separate hospital building and the Egyptian building, which they used primarily for instructional purposes. But you see that the school is, again, listing their rates based on race. The period of the late 19th century is often called or characterized as the Jim Crow period. Here's a definition and why it has that name. In Virginia, the Virginia General Assembly started passing legislation that restricted the mixing of the races in the late part of the 19th century. And then the crowning blow was, of course, the Virginia Constitution of 1902 that pretty much disenfranchised most people of color and many poor white individuals as well. And this strictly stated that there will not be teaching of the two races in the same school. About this same time, MCV opened a brand new hospital. Well, actually, the citizens of Richmond opened a brand new hospital here, the Charlotte Williams Memorial Hospital, known as the Memorial Hospital. This structure still stands today. When it opened in 1903, it was the teaching hospital for MCV and continued as the primary teaching hospital until 1941. African American patients were crowded into the basement. They somehow had 57 hospital beds in the basement to accommodate patients. Some in the community realized that these were abhorrent conditions and almost immediately started on a fundraising campaign to create a separate facility for African American patients. World War I interrupted their progress both on fundraising and subsequently on construction of this facility, but it finally opened in 1920. And as you see on the image on the right, it was billed as the Hospital for Colored Patients. Now, MCV proudly again announced all their facilities and spelled out in their various advertisements who they were for, as you see in the ad on the left-hand side. On the right, ironically, you will see that there's a line indicating that they treat patients without regard to race, creed, or color. Interesting commentary. Now, with the creation of the St. Philip Hospital, MCV, again, because of the Constitution of 1902, had to set up, even though it was under its umbrella, its institutional umbrella, a separate school of nursing. And so the St. Philip School of Nursing was opened in 1920. At this particular time, few graduate nurses, registered nurses, were providing care. The majority of the care was given by students. So if you had a hospital, you needed a nursing school in order to be able to provide student nurses who could give care in the facility. You will be learning more about this. There's a separate module that addresses the St. Philip School of Nursing for you to take on your own, and I encourage you to learn more about this school. So while there were student nurses and a few graduate nurses or registered nurses who were serving in the St. Philip Hospital, no physicians were allowed to serve in the hospital. That's because to be a physician at MCV, you needed to be on the faculty, and the faculty would not be admitting African American physicians to their ranks. As either a mark of white paternalism or perhaps out of maybe better motives than that, the institution did offer periodic postgraduate clinics where they did invite the physicians, African American physicians of Richmond, to come to St. Philip, see the facility, and learn about practices in medical care at MCV. So this meant those individuals, African Americans, found few roles for them other than in the most menial tasks as orderlies, cooks, or janitors at the institution for a good portion of the 20th century. The waiting rooms for the clinics were segregated initially by dividing a room in half and providing one area for African American patients and another for white, as you see in this image that promoted today's presentation. But when the school had an opportunity to create a new clinic, they designed one with separate waiting rooms of equal size on either side of the building. And this is what came to be known as the A.D. Williams Clinic. This is something that is remembered by many in Richmond. And this is what they think about when they remember care there. They remember long lines as they waited to get access to medical care. You may notice the mural that's on the borders in the two images that you see on the screen. This image was retained and restored when the clinic was torn down, and you can now see it today in the McLaughlin building. Well, as you have gathered by those series of images, MCV was taking on a role of the safety net hospital. It's one we still understand today. And it's quite clear when you read the opening of the Richmond Whig article at the top of the screen, where it says, "These clinics are well supplied with material by the large number of poor in this city." And the image below is a group of people of color right after the American Civil War. You can see the burned out buildings of Richmond in the background. On the right, again, you see the appeal to indigent patients. All of this was necessary, the faculty felt, to run their educational programs. So they were happy to appeal to the indigent because this provided learning experiences for their students. At the beginning of the 20th century, many surgeons decided to move out on their own and create their own hospital because they could then be king of their own particular castle. These private hospitals were quite different. Often they were in facilities that were not designed to be hospitals, like the one on the left, St. Elizabeth's. The other two, Grace and Old Stuart Circle, which you see in the middle, were actually designed to be hospital buildings. But here they dealt with paying customers, leaving the indigent to MCV. Now, MCV was a very, very busy place and saw many cases, both in the hospital and in its clinics, as you can see by the numbers on the right-hand side. They are divided by race. Everything was reported that way, in the same way that case studies and case reports given on patients always included the race of the patient. So the St. Philip Hospital, which was the symbol of segregation at MCV for so many, existed as a segregated facility from 1920 until 1965, when the hospitals were formally integrated. It finally stopped being a patient care facility in 1992, although it was more administrative use by the 1990s than any clinical care space. It had its problems, as you might guess. It aged rather quickly. The hospital was designed some 15 years before it was built, so it was almost outdated at the time that it finally opened. And you notice from the headline here that it had a severe rat problem. A city garbage pit was not far away from the hospital, and it attracted rats. The rats migrated to the St. Philip Hospital. Interestingly, there was not the same report of rats in the West Hospital, that was the facility for white patients. But it became particularly acute in 1943, when a rat bit an infant in the maternity ward and the infant died. So you see that a group is going to study what's going on with the rats. But on top of that, the conditions were just poor. As you can take a look with all the equipment in the hall in the upper left-hand corner. The image on the right of a pediatric area is just cram-packed. There's hardly any room to move and give proper medical care. So separate was certainly not equal at all. Well, now I'd like to transition on to student culture to talk about a few things that also help us understand racism at the institution. Students formed cohorts, as you see by this group of nursing students from 1900. Sometimes they did some very wonderful things, as in the case of the women that you see here in this picture. This was a group of nursing students in the formative years of the nursing school. They were particularly devoted to visiting nursing and went out and created the Nurses Settlement that eventually morphed into the Instructive Visiting Nurses Association. And they were able to provide and give access to care to many individuals in Richmond, both people of color and white patients, at a time when many of these did not have access to health care. As the Constitution forbid, the Virginia Constitution that is, forbid educating African American students and white students, African Americans were barred from the educational program for a long period of time. While Brown versus Board of Education opened the public school system for many, it was actually a couple of earlier Supreme Court cases that paved the way for these pioneers to enter MCV in the various health sciences programs. One in particular, Jean Marie Harris, received lots of publicity when she arrived. She was very carefully selected, having come from a healthcare background. She was a resident of Church Hill. That would solve one of the institution's quandaries about, well, what do we do when we don't have African American and white students living together in the same dormitory? She commuted from her Church Hill home to MCV. Her time at the institution was chronicled because it was considered such a novelty that she was here. And as you see from the right-hand image, she made the cover of Ebony magazine in 1955 following her graduation because she was accepted as the first African American intern at the formerly all-white MCV hospital. So although MCV could be proud of its accomplishments in that regard with Jean Harris and a smooth transition for her, it really was nothing more than token integration. And that came to fore some 9 years later, I believe it was, when this gentleman, Dr. Charles Christian, finished #1 in his class, but was not invited to all the social events that normally accompanied graduation weekend at MCV. Times had changed somewhat and even changed within the student culture because a number of students spoke up and protested the move on the part of the administration to allow this event to go forward. A moment about the yearbooks. Many people's attention was drawn to yearbooks in 2019 when Governor Ralph Northam's image from his medical student yearbook hit the internet. Here at MCV, not surprising, was well aware of the racist iconography that filled many pages in the X-ray, the MCV yearbook from 1913 to 2010. But what was surprising is how long some of this racial imagery went on. And in this case, it's students showing poor taste in donning blackface and racist costumes for various school sponsored social events. Now I'd like to transition again to the subject of urban renewal. You might think that this picture from 1865 is an interesting one to talk about a concept that came about in the 20th century, but I wanted you to see what the landscape of Richmond was like, and particularly the vicinity of MCV. So you see how everything is built up on what we know as Court End or Shockoe Hill. And what is down in the valley was formerly a stream known as Bacon's Quarter Branch that kind of curved around the hill and definitely created some topographical boundaries for the area, but ultimately would do that for the institution as well. So clearly MCV didn't have much place to go down in the valley, but they could consider other areas in the Court End. Now, the area in the valley changed drastically between the 1865 image that you saw and the image that you're looking at here from the early 20th century. To get your bearings, at the top in the middle of the image is the old White House of the Confederacy, and then you're looking at the dilapidated houses that fall below into the valley. These were the immediate neighbors of MCV at the beginning of the 20th century. Broad Street was a little better, although not much. This was known as Richmond's red light district, and it surrounded MCV on other edges. Gradually, though, as the school began to mature, they began to expand, and you can take a look at some of this expansion in this image from the early 1940s when the big MCV West Hospital is now built. But you notice that there's still some vacant areas as well as still some residential section of the area that is now totally encompassed by our campus. Helped by a 1946 Richmond master plan that visually outlined what were the areas dominated by African Americans in the city, MCV was armed to take advantage of areas that were maybe less well off and scoop up property to continue their expansion. The homes here that you see at 12th and Clay Street and now the site of the Health Sciences Library were some of those grabbed by the institution and the homes raised to make way for new construction on the part of the medical school. Of course, a more dramatic change of the landscape occurred with the construction of the Richmond-Petersburg Turnpike, which was incorporated into Interstate 95 shortly after it opened in 1958. You can see the large swath that was cut out of Richmond, including historically African American neighborhoods such as Jackson Ward and Navy Hill. You also see a lot of the open spaces that are going to be disappearing following the construction of the turnpike. Interestingly, MCV was somewhat saved by not having the turnpike run straight through it, although they ultimately had to give up 12 acres to the Turnpike Authority in order to complete the project. The project created a new gateway for the institution with the Broad Street exit, and here you see it under construction. I'm sure many of you use this exit every day when you come to campus. With the interstate or the turnpike having changed the landscape, MCV now had entree to go and develop in other areas. One of their first big projects in some of the former Navy Hill area, still while there were houses that were visible, as you can see in the left-hand side of this image, new dormitories were erected. Following by probably another severe insult, the construction of the Commonwealth Civil War Centennial Center. MCV owned the land and agreed to allow the Commonwealth to build a Civil War Centennial Center to be used from 1962, I believe, when it was created or completed, to 1966, and then turn the facility over to be a student center at MCV. This also came from land that was associated with Navy Hill. So today, relatively new, there's a few new structures going up that aren't shown in this 2016 image, but today you see the campus, and we've almost encompassed every square inch that existed in those areas I've just discussed, and we certainly form the eastern border of the city before it's divided by the interstate. So our final theme is research. And I want to go back to the 19th century briefly to say that the roots of research at the institution actually started in the 19th century with this man, Charles Edward Brown Sequard. He only spent a year at MCV, but he did much memorable research that later brought him a reputation internationally as a physiologist. And the Brown-Sequard syndrome is named for him. Now, from that, there was other research that was ongoing, but research again picks up during the 20th century. And it got a kickstart from this man, Dr. Everett Evans, who was the founder of the Burns Center, or the first civilian burns center in the United States in 1947. And he had a number of Army contracts to study flash burns in humans as part of the Cold War period of research, when investigators were looking into what could happen from atomic fallout. So you see a picture of him here in his lab, one of his publications on the right. His work was chronicled in the local newspapers, And of course, I'm sure some of these headlines will give you pause today, as it notes that students were given burns, prisoners may volunteer, and even scientists were participating in his various experiments. Well, once again, this kind of got uncovered again some years later when an environmental activist came through and published an op-ed piece in the Washington Post accusing MCV, as you see in the quote on the screen, of dangerous experiments on unaware human subjects. Well, he didn't quite have his facts right, but nevertheless, some research was going on that we certainly would not endorse today. Part of the reason for that is there weren't certain safeguards in place, as you see outlined here. While a general informed consent has been around for a long period of time, informed consent, full informed consent, understanding what the ramifications of the experimental work proposed is relatively new, as you see by the timeline shown here, coming from the Nuremberg codes and culminating in the Common Rule in 1991. In this climate, another significant researcher arrives, and that is Dr. David Hume, to be professor of surgery in 1956. He had gained a reputation as an early transplant pioneer when he was at Boston. He brought his work to MCV and began preparing to do his own transplant. He had been involved in kidney transplants, pioneering work at Boston. And he then in 1957 did a transplant between identical twins, bringing much notoriety to the school. He was interested in continuing this, and again, as these headlines show, he was reaching out to see where he could get donors, again from convicts, talks about his research work, all of this in the local papers, so the local community could follow along. He was interested in expanding and moving into the area of heart transplant in the 1960s and recruited Dr. Richard Lauer of Stanford, who had done a lot of early work in animals on heart transplantation, to come to MCV and establish a cardiac transplant unit. And it was Lauer who then performed MCV's first heart transplant in May of 1968. He also was the one that Christian Bernard, who performed the world's first heart transplant, learned the technique from. Bernard was at MCV for 3 months in 1966 to learn about initially kidney transplants, but wandered into Lauer's lab and learned about the procedure for hearts. Well, after this first transplant, there was almost immediately some pushback because there was questions about the heart donor, as you see from the headlines on the paper. The transplant was in fact performed in the old MCV hospital that you see here on the image, a contemporary image. Eventually, the family of the heart donor, Bruce Tucker, his family, took the MCV surgical team to court with a wrongful death suit. They were represented by then State Senator L. Douglas Wilder, suing the transplant team. Well, with instructions from the jury, the jury found in favor of the surgeons, and in the process, convince the jury to accept this notion that death occurs when the brain dies. And this would then serve as the foundation for Virginia to alter their definition of death and include brain death in the equation. You may have learned a little bit about this recently in a new book called The Organ Thieves. Well, with the transplant in 1968, it's time for the medical college to move on to another chapter, and that is to be part of a new urban university, comprehensive research university, and that came about on July 1, 1968. Here you see Governor Mills Godwin signing the legislation that would create VCU. So there is much to contemplate and analyze in the narrative I have relayed this afternoon. Perhaps this is the first time you have confronted it. My goal has not been to indict MCV, but to understand how structural racism developed and how our institution's history affects the way people understand and experience their life and medical care. Learn from this history, discuss it, and help VCU move on to a new chapter of true equity. Thank you.
Thank you, Jody, so much for that wonderful and very in-depth presentation. My first thought is just wondering, as we move, I actually think that you just got a compliment that came in through the chat. This is a wonderfully informative historical review. And I think that really goes for, I think everybody in attendance would be, if we were all in the same place, I think we would give a round of applause, because I know that took a lot of time and effort. And as we think about moving over to our question and answer session, my question is, was the plaque removed last summer? Do we know that? And I'm not
Yes,
sure
the plaque that I showed, the plaque I showed on the screen was in fact removed, along with the removal of names that were associated with the Confederacy and other plaques and some artwork.
Okay, let's see. Well, that was quick. Next question was, when did MCV first allow African-American physicians as faculty or as students? And I think you kind of addressed that.
Yeah, the first students came in the fall of 1951, and that included Jean Harris. Sadly, the first African-American faculty member is not until 1969.
Wealth of knowledge. Okay, let's see here. Next question, does the 1965 integration date have anything to do with the Medicare Act?
Yes, it does, completely. MCV probably would have dragged its feet longer, in part because of the social conditions of Richmond. I mean, they were caught between a rock and a hard place. They needed to remain economically viable. And if citizens in Richmond weren't willing to come to a segregated facility, they were going to be hurting. But they had no choice. The federal government was not going to let them in on the largesse of Medicare and Medicaid unless they got their act together and no longer segregated their clinical facilities.
Oh, wow. Let's see here. I think we had a question in the chat. I see. Did MCV VCU publicly advocate for and support the turnpike construction in a similar way to the Navy Hill TIF proposal? They are curious how the leadership perspective has changed on the health system's role in local politics.
They were certainly involved. I'm not sure to the point of endorsing and advocacy, but certainly their thoughts were taken into account. And there wasn't much pushback in MCV moving westward and basically eliminating all the residential areas in the Court End.
Okay. I think we had one more. Yeah, I think this is a great question. How can we honor the lives that have been wrongfully lost and fight against the history of racism while we work and study in healthcare?
That is a good one. Well, one is to get these stories out. You'll learn more again about the East Marshall Street Well project, but we're just about on the verge of unveiling some new banners that will be going in the Contos building that will talk about the East Marshall Street Well. And so I think it would be appropriate to incorporate and to memorialize others that were victims of the institution when the opportunity arises, and welcome student input on that and how that would be appropriate and where they think that that would be, can be appropriately done on campus as well.
Thank you for that. Looks like we've got a couple more, if that's okay, before we transition. I'm not sure if this was answered, but were the remains in a good condition that they were able to find the families?
They haven't had extensive DNA testing done yet. That are some of the recommendations from the Family Representative Council, that we do a little bit more. There they're trying to balance invasiveness and against trying to learn more to see if we could in fact identify them. They were actually in surprisingly good condition because that they were essentially underwater, so that helped protect them. So in fact, at the time that they were excavated, there were still bits of soft matter that was attached in some cases.
I see. I think a good follow-up someone posted is, do you have suggestions for additional reading besides the organ thieves regarding MCV's controversial medical history involving people of color?
That's tough. We certainly have plenty of things that you can look at in the records, but unfortunately, the organ thieves is one of the first attempts to kind of look at the underside, if you will, of the institution's history. Most of the histories have been more, let's say, honoring the institution or publicity based or that kind of thing. And so they don't take a critical look at this. So there's plenty of fertile ground for scholars to come in and write a little bit more. But I can, if you do email me, I can make some recommendations on readings of articles, either for certain episodes in the institution's history or what happened at other Southern institutions. We are similar in some ways.
Let's see.
Yes, Richmond's Unhealed History. That's another a good book too.
I think this would be a little bit challenging to answer. However, the question is about medical trials carried out in order to test anesthesia. Is it safe to assume that some who were experimented on did not receive anesthesia as a part of the experiments?
Wow, that one is hard. I mean, for the most part, and even there's often a myth told about soldiers biting on bullets during the American Civil War, during surgical procedures, amputation in particular. Surgeons wanted their patients to have anesthesia because it made their job easier. So with that in particular, there wasn't the same kind of experimenting. What the experimenting is more on the surgical procedures that were done and the fact that they were not done with consent. And by that, yes, a patient may have said, treat me, but they had no idea, well, what does this procedure involve? What are the potential complications from it? None of that was explained to many of the patients that were victims of experimental surgery in the 19th century.
Absolutely. I can imagine that. Let's see. They're coming in good. Okay. All right. Does the local Black community refer to VCU Health in ways that are still tied to the legacy, like calling it St. Philip? My family is white and still calls it MCV. So I'm curious how the holdover affects current community concerns with race.
There are plenty of them. That's why I'm always happy for an opportunity, especially for our students that are not from Richmond, not from Virginia, to be introduced to this so they can understand. These legacies have very deep roots, and these stories are passed from generation to generation and very much are part of the patient experience today, because they bring these experiences with them, whether they happen to experience them personally or somebody in their family, or they've just been told the story.
Very good. I think we'll do one or two more questions and then we'll transition. The next question is, I've heard that tunnels under the hospital lead down to Lumpkin slave jail in order to retrieve bodies. Is that true?
No, that's not true. The tunnels are all a 20th century development. They were constructed actually for a purpose to run steam to the Capitol complex, to MCV and a couple of other state buildings. And so they way post-date the Lumpkins jail.
Okay. I think I'll pose the final question to you before we transition. Again, as everyone has shared, this information has been extremely eye-opening. For some, it has been news. For some, it has been something new that they've learned, especially I've learned something new. And so my question to you is, how is it like aggregating all of this data and getting it all into one slide and over the time? How did you feel when you reconciled that this is the information that you are finding in addition to having to present that?
It's a challenge because I just feel like there's not really enough time to delve into all of this in the detail that I would like. And you have to, I don't want to assume too much in terms of general historical trends on the part of the audience, but I don't want to kind of get bogged down in the huge national or even state context. So it's tough. I also want to try to be respectful. You may notice I didn't use any of those classic student and cadaver shots. Again, just to be respectful of the audience. I know they are very upsetting to many, and so I specifically left those out. So I don't know if that's a good answer, but it is a challenge. And I did what I thought would be useful, and I organized it the way I did because I thought maybe in remembering those themes would help everyone remember some of the stories and understand that these areas do have an impact on delivering healthcare today.